burnout. So the nature of the job, being in healthcare, being a healthcare worker is also pretty stressful because you're constantly engaging with people. It's different when you do a computer job, you know. For example, you can always work on something and stand up and go to the toilet. But when you're in healthcare, you literally have someone in front of you. You're almost even questioned for wanting to go to the toilet. It's like, what are you doing? You are going somewhere, or you know, even when you want to take your lunch break. And even just the fact that the case is right before you, you know, it's not the kind of situation where you can sort of, if you're seeing a client right then you have to make decisions right there and then. You can't really say, can you give me an hour or two to read and consult, and then I'll get back to you. You still have to act right there and then. So that can be quite stressful. It's also stressful because we usually work when others are not working, okay? So nighttime, typically people don't work, but you know, in healthcare, you find yourself working on weekends. There are some family occasions which you don't attend because you have to work. During this COVID period, a lot of people had the privilege of working at home, and you don't get to have that privilege. And then also working with very ill children can be very stressful. There is a notion we have that, you know, children are so innocent, they must not suffer. There's a lot they cannot understand about life, and it can be very torturous to see a child going through a lot of pain and hurt. And we also work in high risk areas. So the increased risk of infection that we expose ourselves to also further, you know, increases the tension and anxiety on the job. You can even see this person just literally coughed into your face, puked onto whatever while you were pricking the needle, blood splashed on, you know, constantly dealing with highly infectious situations, high risk situations, and those become very difficult. And sometimes with children, you're trying to put a needle and they kick, you prick yourself. There's just a lot that goes on. But also another thing that causes burnout is working with non-team players, especially in government institutions. There's usually a person or two who just not do their job. They come late, they knock off early, they have long lunches. When they're around, they're as good as not being around, and accountability is very low. And so even when the workload would have been normal, but because people are not doing their job, you find yourself being very, very stressed, because some of them maybe even just, it's just even an attitude problem, and working with them can be very, very difficult. And then, as Dr. Mwaba said, you know, losing patients, because we do get attached to our patients. Well, we may not be attached to all of them in the same way, but there'll always be a patient or two that will touch you in a special way. You know, you find yourself connected beyond the way you're usually connected, and just sort of walk the journey together with them. And something about this particular person just touched your heart, and at some point that person loses their life, and you find yourself grieving, but you know, you can't really take a day out. You can't really find yourself saying, oh, I just lost a patient, can I have 2 hours to rest? You know, there's nothing like that. You quickly have to move on to the next patient and continue working and not have to deal with some of those. And some of those are the things you then think about after you knock off. And all those things can contribute to burnout. And also working during COVID, I think, has been a stressful time for a lot of health workers. I don't know what's happening in your departments, but a lot of departments have had to double screen, you know, like whatever else they're screening for and COVID-19. And apart from the usual safety procedures that they put in, they also have to protect themselves from the COVID. So all those things, trying to make sure work processes are different, ensure safe and social distancing among patients, and all those things. And you find that even that has caused its own kind of burnout. But aside from that, you know, we are also our own persons. So yes, we have this workspace, but we also come in with our own issues at work, you know. had an all-night argument with your spouse, or your child is having their own tantrum, your mother is unwell, you have your own bills to pay, and so on. So different personal demands as well, despite the fact that the job itself may be quite demanding. Then you also have those personal demands coming up as well. Other studies that were done, like the same study I referred to, the Medscape study, they found that some of the causes of burnout involved the many bureaucratic tasks, like the paperwork that they have to do, the increased computerization of practice. So like one of the things that I've noticed in some situations, you write in the file, but then you still have to go and upload the information on the computer so that everyone else has access. And just so many of these things. And some of the things like there, the third item from the bottom talks about lack of respect from patients. And some of those things also can cause burnout. They have no idea how much you've put in, and then they feel like, what are you doing? Do you even know what you're doing? Did you even go to school? Questioning you because they've, sort of read up on Google and learned a few things. And also government regulations. Some of the government regulations may also be, difficult. So in the US, they've found that some of those things have been difficult, and lack of control or autonomy, where you feel like you cannot just do what you want. There are some restrictions on certain things, or even limitations. I know for a fact, for us, one of the things that's really, really stressful is knowing that you're not doing the best for your patient, because while you're trying to do this test, there were no reagents, so you couldn't confirm it. Then you wanted to give this antibiotic, but then it's out of stock and the patient can't afford, they can only afford this one. And yeah, so many different things that affect the management of the patient that can actually even cause burnout. So is it common? I think that's another question that I thought would be nice to answer. So this is a study that I was referring to, the Medscape National Physician Burnout and Suicide Report of 2020. And it was called the generational divide because they actually compared three generations, the millennials, Generation X, and baby boomers, and tried to sort of compare the responses among them, which we're not going to go into. But these are some of the stats that we have, like, between 2011 and 2014, burnout increased by 9% among physicians, okay? And they found that it's about twice as prevalent among physicians in the US workers as compared to other fields, the amount of burnout. And then also when you look at this chart, just looking at the percentage of suicide among female physicians, which was like, 130% compared to the rest of the population, it's significantly high. And for men, 40%, higher than the other males in the rest of the population. And then down here, it talks about how 35% of hospital nurses have a high degree of emotional exhaustion, So you can see that it's not just you guys who are going through that. These are things which have been noticed everywhere. There was a study which was done in 1,171 registered inpatient nurses, and they found that 18% had depression compared to the 9% in the population. So almost twice as much as in the general population. And just recognizing that having a job like that already puts you at risk of burnout and some of the complications of burnout that are like mental health disorders and things like that is an important thing. So what are some of the signs and symptoms of burnout? Compassion fatigue. Does anyone know what compassion fatigue is? I think this is a common one. So I hope someone can explain what compassion fatigue is. So this is also my way of checking that people are listening. Yes, Chisambo, you can answer.
I think it's where you empathize less with your patients. Like even when somebody feels pain, you're not as empathetic as you used to be. Yeah, my limited understanding.
No, you're right. So it's like you feel compassion, but you know, we have a limited stores. We have limited stores of compassion. You can only have so much of it. So your first case, you feel very compassionate, you feel very bad. Then you see another one, and then a third one. By the time you're getting to, it's like there's nothing more left, you know, that you are feeling. You literally have been tired out of feeling sorry for people or patients. You find that there is lack of enthusiasm for work, so no passion anymore, you know, in doing the work. Inattention, so easily distracted, not focused on the work, lack of innovation, creativity, or ingenuity. And you can even see it, you know. This happens when, let me give a basic example, which may not be a practical example, but I'm just giving an example. You have somebody with a wound and you're supposed to cover it, and then you come back and say there are no bandages to cover the wound, and so on. But this is something that needs to be covered because maybe the patient is moving from one place to the other. But then somewhere there is some kind of crepe bandage or something. So ideally, you would use your innovation to think about covering that because you really need to cover it because the person is moving from one place to another. But if you have burnout, you're just like, there's nothing. I don't know if you experience those kinds of situation, you know, you have normal saline and you have 50%, but then the doctor said 5% dextrose. So since there's no 5% dextrose saline, you're not going to use the normal saline and the 50% to make dextrose saline because no, the dextrose saline is not there. So I find that people have that kind of lacking of creativity, or what we sometimes maybe in a harsh way would say lack of common sense, because the person just is not caring, you know, they're just not passionate about what they're doing, and the person is disengaged. You can see that at the slightest invitation to do something else, to go for a workshop or do whatever, they're jumping at that opportunity. One of the things that would always really, really irk me is how long nurses would go and collect drugs with the drug charts. Like seriously, can somebody go from 8 hours to go and collect drugs and come back at 11, you know? And I know when I'm saying this, I'm saying controversial things. I don't know what really is happening in your words, but I'm talking about my own experience, you know? Those are things that would really irk me. But even when the person is coming back, they're kind of just strolling on the way. They even have, you know, vitumbua, 3 of them and so on. You can see that the person is disengaged in their work. It's not something they're rushing for. It's not urgent. It's not, yeah. And then frequent non-specific physical ailments, headache, backache, muscle aches, flus, and so on, because generally the person has lowered immunity. And poor sleep can also be a sign that a person is experiencing burnout. Appetite changes as well. All those things can signify that a person is experiencing burnout. And what are the effects of burnout? Like, why are we even talking about this today? Because if it's a personal problem, then maybe we wouldn't care so much about it. But the truth is that at the end of the day, that burnout has an effect on the work output, okay? Already I was talking about the lack of innovation, the fact that our patients' care is compromised because we are burnt out. We're not being innovative, we're not engaging. So tired doctors make mistakes. Tired nurses make mistakes. And you find some of it also in extreme cases of burnout. People are just isolated from others. Absenteeism whenever they have a chance. Remember, I talked about long lunches, coming in late for work, knocking off early, lowered immunity. So every ailment really for you, you are getting it because you're so burnt out. Poor interpersonal skills. You've even forgotten what it's like to say the word please, you know. Things are just commanded around, no need to be polite, because it requires so much energy when you're burnt out. And poor career progression. So stuck in the one place, not thinking about moving ahead. Maybe you keep rewriting the same course. Maybe you're not even rewriting the same course. Maybe you just even don't care about those things. And then in complicated cases, you also have mental health disorders. A person then can get into depression, substance use disorders, anxiety disorders, and so on. And really, the other disorders that are related to mental health problems. So, what can you do about burnout? I thought that I should talk about two aspects, and this is a really short presentation, so I wanted to make sure that I leave at least a couple of things with you. And one of them is team care, thinking about what you can do as a team. And the second one is self-care, okay? So starting with team care, one of the things that you can do is just focus on clear and basic communication, because that prevents a lot of misunderstanding, undue tension, and reduces mistakes. Sometimes the way we communicate in the hospital, you use these terms which, in a sense, it's a teaching hospital, so you should really be using these big terms to help people push themselves, but also being able to differentiate between what are you really trying to do? Are you trying to test somebody or give care to the patient? So if you're trying to give care to the patient, make sure that your team really does understand what it is that you're trying to say. Instead of just using complicated terms to test if people are up to date with their learning. I hope it makes sense what I'm saying. And handovers, if you hand over well, you find that you lighten the load for each person who's coming through, okay? We understand, why didn't this person, do you know if people drew blood? Did people follow up from the lab? Why did they not give this medication? Things should be so clear so that each team finds it easy to take over from the other, and it just becomes easier for all of us, because we're making way for each of us. And then also believing the best about one another. One of the things that makes it really difficult to work in teams is if you keep believing that person is out to get me, and this person is just trying to show me that they know more than they do, or trying to show me that they know more than I do, or trying to show who's more senior, and so on. And things like this can really, really affect the environment that you're working in. In the medical field, there's a lot of bullying that happens, and some of it is among even colleagues, professional bullying and so on, trying to make people feel your weight around. But the cost of it is so much, because at the end of the day, there's a lot of stress that people in the team end up feeling, and that ultimately also results in a lot of conflict happening in the team, and stress that can also cause burnout. Then be gracious, okay? So if somebody does make a mistake, we are not saying that you should not hold people accountable. By all means, everyone should be held accountable. And that's another thing. Sometimes we're scared of holding people accountable because, oh, I'll look like a goody-goody and so on, but you're not helping if you don't hold people accountable. But the key is you can actually hold people accountable and still be gracious, okay? Still be understanding that this is a high pressure job, there's a lot to do, and it's possible that this person just made a mistake, because I'm pretty sure that no one in the team is out there to murder anyone. And so believing the best about each other is also very, very important in trying to get the team spirit. The other thing is being able to debrief. So I'll spend a little more time talking about debriefing. And the reason is that in the absence of having therapy for each of you, in the absence of being able to have that kind of system, one of the things you can do for one another is just make sure that you debrief, okay? So why do we debrief? One of them is to provide support for one another, because when you're going through a crisis or a difficult situation, it's nice to feel that we're in this together. Also, debriefing is important because it can prepare people for the impact of the crisis, okay? So you are sort of prepared that you've gone through this stress and going through this hard time and so on. And then it's also important to enhance communication and facilitate teamwork, because then during that time, you're able to talk about the different things that are going on. And you can communicate better, like, oh, I thought you meant this. This is what you meant. So in future, maybe we should communicate this way, you know. So all those things are helpful. And also it gives an opportunity to assess what you're thinking and feeling. So in the team, you can be able to assess who is really having a hard time, who has really been impacted terribly by this thing, and who needs more support in their work. Aside from that, it can relieve stress and the weight of a difficult situation. So those are the reasons why we need debriefing. But how exactly can it be done? Okay. So the first thing is to set guidelines. I'm not sure how you run your wards. I'd like to think that there's a handover round at some point. But one of the things that's also helpful, the focus of the handover is usually the cases of the patients, but also just focusing on the care of the team and assessing what are the needs, whether they are learning needs or emotional needs or work needs and so on. That's very important. And typically it would be nice to have a debrief session every day, because you go through, encounter things that are difficult every day. But if you can't, if you can even just do it once a week, that would be very helpful. And so the guidelines and expectations, you talk about them, like this is what we'll be doing during the debrief sessions and so on. And the first thing is the fact phase. Ask what happened, okay? So in case there's a crisis, usually a debrief session is important when there's been a crisis, something terrible has happened and has shaken the team. And so you get to that phase, what happened? And this is just basically about the outline. This is what happened, this is how our shift went, this and this happened, and so on. And then the cognition phase, to allow people to talk about what happened in terms of how they thought about it. No, the reason I did this was this. I thought this and I thought that. And then the reaction phase gives people an opportunity to talk about how they felt. Like, after I thought like this, I felt disappointed that that patient still died, for example, because I had a lot of hope. Or I felt disappointed that, you made that decision because we had a tutorial last week and we already talked about this. And this is how this, so I felt like it was a direct act of rebellion or negligence on your part or whatever. And then the effects. So discussing what the impact of that situation was, like how has it affected our team? How has it affected our work going forward? And then the education phase, like learning from the situation, going forward, how can we do this differently? And then you evaluate the situation. Oh, we can do this way, we can do this way, and so on. And then finally, you have the re-entry phase where you have an opportunity to discuss any other issue. You will notice that one of the challenges, I think, like when I've been working with some of the teams in the hospitals trying to do support, one of the biggest challenges that I've found is that different people have different shifts. So doctors seem to have their own shift that they start at this time and knock off at this time, and nurses have their own shift, and as a result, it becomes a bit difficult to have a multidisciplinary team meeting or a departmental meeting. But I would encourage you as a team to try and make it happen, even if it's just once a week, where you sit around and just check in on each other. Because I think one of the saddest things that has been going on in the health field is having a lot of different people go through stuff and we can't help each other. We can't help one another. You've noticed this person has been absent from work and other people are covering for the person. There's no accountability. No one is able to say, actually, this person has an alcohol problem and they need help. Or this person actually didn't come that day because they were battered by their husband the night before and we really need to support this person, and so on. So just being able to have those kinds of meetings that would be able to assess the needs and support in the team would be very, very helpful. Okay, so we'll talk about the next part, which is self-care. A lot of times people misunderstand self-care. I put those candles there because a lot of times people think about self-care just in terms of pampering, but it's more holistic than that. And we'll talk about what to do as an individual. The first thing is when you are going through a crisis or a stressful time, focus on what you can control, okay? So we'll talk a bit more about that later. But this is really critical, especially if you're working in resource-constrained environments, because you have a ton of things that you think about which you cannot control, but stress you, okay? So focus on the things that you can control, whether it's for your individual life or for your work situation. Then maintain safety procedures, even if it's tedious. Because remember that at the end of the day, if you get an infection and so on, that stress on you will cost you a whole lot more. Okay, so you have to maintain those safety procedures, especially now that there's even COVID. It's important that you maintain the safety procedures, all those many hand washings that you have to do, the sanitizing processes, and so on. Then there's what we call ACE. And in ACE, it's basically a self-care measure that in each day you should consider something that makes you feel a sense of achievement, a sense of connection, and a sense of enjoyment or enrichment, okay? So in terms of a sense of achievement, it could be your work, it could be something that you're reading or writing, learning, it could be something like gardening or cleaning, but something that makes you feel a sense of achievement. And then connection. So reach out to someone who loves you or cares about you. I like to emphasize that somebody who loves you and cares about you rather than someone who you love, because there are some people who we love who are not very refreshing. And some of them are abusive to us, and some of them are really a source of stress. So in terms of managing yourself when you're going through stress or just day-to-day management, reach out to someone who loves you and cares about you, who will refresh you. Then the E on the ACE is enjoyment. So doing something that you enjoy in a day. So maybe watching something that you like, even if it's reading something that you like, listening to some music and so on, but something that just allows you to have a moment where you feel like this is my moment, this is something that I can enjoy. Having this balance is very important for you day to day. One thing that we do when we're talking about self-care is also journaling. Being able to ask yourself reflective questions and evaluate, and then write it down. Like, so what kind of day did I have today? I think I had a good day because I was able to talk to health professionals like me and connect with them and give them support on self-care tools. You know, how did that make me feel? Is that something I want to continue doing? What impact did it have, or did it even have impact? Was there a way I could have maybe made it better, and things like that? So just thinking through the different things in my day will also help you to live a more meaningful life, because you're more deliberate about the moments that are happening in your life. And exercise. Sometimes we excuse ourselves because I was walking up and down in the ward so much. I think that's enough exercise. So no, exercise is supposed to be an intensive period where you have your heart rate significantly go up and you have a good sweat. And you should have at least 30 minutes of that, okay? If you can have 3 to 5 days of the week doing that, that's great. By exercising, you will improve your mental attention, you will be able to improve your posture and even to help your mood as well. So you'll find that it's not as stressful for you because you're able to exercise. And then also to eat healthy. And you know, like right now, my memories of PIDS are still thinking about. One of the struggles I used to have was just trying to find some decent eating place where I can find some decent food. There was always that place in the corridor where they would sell cupcakes and whatnot, which are not necessarily healthy. But this might mean that you might be a bit more deliberate about making your own food. But what I would recommend is that if you can have one balanced meal a day, that's good. A full balanced meal, rich with vegetables, rich with protein, lots of water, that would be good for you. And then also resolve to be a team player. Contribute your efforts, pursue team goals, and ask for support where you need it. So sometimes it's intimidating when you're working with in a teaching hospital to just be able to say, I don't know this, I haven't learned this, but it's an important aspect for you to be able to reach out and say, look, I need support here, I need extra help here. Earlier on, I talked about an exercise where you focus on what is within your control. This little exercise is an exercise that you can practically do when you feel stressed, when you feel overwhelmed, whether you just had an argument with your spouse or your mother, or it's something to do with money and you have bills to pay, whichever the case. Just sit down and draw some of these circles and just ask yourself, what is within my control? And then, what is it that I can influence? And list down the things that are within your control. For example, usually your attitude is within your control, your thoughts and feelings are within your control. And what you can influence, perhaps you can, if it's your landlord, you're paying rentals, you can perhaps have a negotiation about having a little more leverage. Maybe you can try and, talk to them about, you could influence their attitude in one way or the other. Maybe you could pay half and pay some later. So that's within your influence. And then everything else that you can't control. For example, your landlord's reaction, if they're going to then blow up, that you can't control. So being able to recognize in a situation that this is what's in my control, this I can influence, this is everything else, will really, really be helpful in that. And this can also happen even when you're on the ward and you have so much ward work to do. Just being able to say, look, what is with